Hello, this is Dr. Do again. This video is on alphabetic list of problems. Today I'm going to talk about the hypothalamus and diseases along the endocrine axis. So is there any emergency situation associated with this hypothalamus or the axis of endocrine system? Yes, I think this involved the axis, this endocrine axis had 3 levels of organs to regulate the endocrine system to maintain the homeostasis. The first level is hypothalamus. The hormones secreted by the hypothalamus are called releasing hormone. For example, the thyroid hormone, releasing hormone. Now this hormone functions as a pituitary gland, and pituitary gland secrete hormones called stimulatory hormone. For example, thyroid stimulatory hormone, TSH. And this stimulatory hormone function at the 3rd level target organs like thyroid. And thyroid start to secrete thyroid hormones like T3, T4, circulating the blood and to regulate metabolism. So this is the fundamental mechanism of this endocrine axis. Having said about that, are there any emergency situation associated with this with this endocrine axis? Yes, as I mentioned before. For example, the acute thyroid crisis, which is an acute situation, the thyroid organ is under attack either from inflammation, autoimmune, or any chemical or medication, whatever the cause. Suddenly, huge amount of hormone released into the blood. Increase the metabolism and causing this hypertension, heart rate elevated, and also flushing. That's very dangerous. So this is the emergency situation called thyroid crisis. Or on the other hand, if this adrenal gland had this situation, either overproduct of hormones or not enough, for example, if overproduce epinephrine, which is from adrenal gland, then will cause acute elevated blood pressure. It's also very dangerous. Or if the adrenal gland collapse, suddenly lost function, then there's no enough epinephrine, then cause hypotension. That's also dangerous, and shock. That's also emergency. And along with that is the decrease of the corticosteroid and other hormones. So that's also emergency situation. You need to see the emergency room or call your physician as soon as possible. So these are the one end of the series conditions associated with this endocrine axis. Is there any conditions? Are there any conditions along with this axis that you can manage at home? Probably not. Even though, regardless whether severe or mild, has to be managed. Get advice from physician or supervised by the medical professionals. So having said about that, let's just briefly mention about this endocrine axis. Like I said, there's 3 levels of organ: pituitary gland and hypothalamus, and the target organ usually referred to thyroid, parathyroid, and also the adrenal gland belong to this axis. There is another very important endocrine organ, which is pancreas. However, pancreas secretion was regulated by the metabolism and by the digestive hormones. So this is not in this axis, not in the realm of this axis, regulated by different pathway. But when we talk about this hypothalamus, it's in the brain, and also, like I said, secrete multiple of the releasing hormone. For example, I already said, whatever the organ, the target organ, the releasing hormone is named by the target organ, like thyroid, releasing hormone target at pituitary gland, and secrete the stimulatory hormone, and then cause this increase the secretion of the thyroid hormone. And there's the regulatory mechanism is through the feedback. For example, if the hypothalamus continuously to secrete this releasing hormone, target function at the pituitary gland, continue to release the secret stimulatory hormone, and then the organ of thyroid, for example, will continue to produce thyroid hormone and to the extreme. However, there's a negative feedback mechanism. So the target organ, for example, thyroid, reach to the level to meet the requirement of metabolism, then send the signal back to the pituitary gland, to the hypothalamus, that I got enough hormone, no need to secrete more releasing hormone or stimulatory hormone. So this is the major mechanism to maintain this endocrine homeostasis. So not overproduced or not produced enough in the normal situation without any diseases. However, if during the diseased condition, this axis, the signal passing along this axis, either from target organ or from pituitary gland or hypothalamus, is just interrupted. So it's not regulated as it's supposed to be. For example, long-term disease of thyroid, either hyper or hypo. Let's say long-term hypothyroidism. So this will be the thyroid gland couldn't produce enough thyroid hormone. So this signal sent back to the pituitary, to the hypothalamus, that I need more stimulatory or releasing hormone. So these two organs will continue to release this. That's why this is one of the mechanisms to test, to diagnose the hypo or hypothyroidism. If it's long-term going without treatment, without management, and then eventually the signal will be keep sending to the hypothalamus or to the pituitary gland, will get exhausting. So the system, the axis, will lose the fundamental function. It usually is not going to happen because the management, the replacement of hormones, so this axis will continue to maintain the normal regulation level. So that's one of the significance of many medical management if there are some diseases. So have talking about this axis. So then next time I'm going to talk about the other endocrine organ, which is hyper or hypoparathyroidism. Just give in between this, I just insert this hypothalamus and the regulatory axis belong to the endocrine system and also associated diseases. I hope it gives you some idea in terms of testing, diagnosis, and also in terms of the regulation. Thank you for watching. I will see you next time.